Hi, my name is Betty Smith, and I am a family nurse practitioner, and I am doing my YouTube presentation for caring for special population mental health. The elderly and geriatric brain of America. Brain of America by the year of 2025, the world's oldest population, 60 and older, will approach 1.2 billion. Then by the year of 2030, one of every five people in the US will be 65 or older. Older Americans will number more than 65 million. Epidemiology: one in four older adults experience issues with their mental health. The most common issues are depression, dementia, and anxiety. Depression and dementia are the most common, affecting 5% to 7% of the population over 60. Economical costs. Because of the graying of America, the increased needs, mental health is established at $1.9 billion will be needed by 2025 to cover the minimum cost of elderly mental health care. We will examine the most prevalent mental health that affects the elderly. Depression, diagnosed with DSM-5, the major depression, personal symptoms may fit the criteria of the DSM-5, and feeling of sadness, low mood, loss of interest in their activities, must have changed a person's previous level of functioning and have persisted for at least 2 weeks. The feelings must be accompanied by at least five other symptoms of depression, including change in appetite, loss or gaining weight, sleeping too much or not sleeping well, fatigue and low energy most days, feeling worthless, guilty, and hopeless, an inability to focus and concentrate that may interfere with daily tasks at home, work, or school, movements that are usually so agitated, and change in is often noticeable to others, thinking about death or dying, suicide ideation, suicide attempt. These symptoms must cause the individual clinical significant distress or imperative in social, occupational, or other areas of functioning. The symptoms must not be of substance abuse or another medical condition. To be diagnosed with a major depression, a person must not have had a manic or hypermanic episode. Common forms of treatment for depression include psychotherapy, counseling, or talk therapy that can help a person identify and change troubling emotions, thoughts, and behavior. It might be done with a psychologist, licensed clinical social worker, psychiatrist, or other licensed mental health care professional. Examples of approaches specific to the treatment of depression include cognitive behavior therapy, CBT, and interpersonal therapy, IPT. Medication for depression. We have already been studying the ones that balance hormones that affect mood, such as serotonin. There are many different types of commonly used antidepressant medicine. SSRIs are antidepressantly commonly described to older adults. A psychiatrist, mental health nurse practitioner, or primary care physician can prescribe and help monitor medications and potential side effects. Electroconvulsive therapy, ECT, during which electrodes are placed on a person's head to enable a safe, mild electric current to pass through the brain. This type of therapy is usually considered only if a person's illness has not improved with other treatments. I am an old psych nurse, old RN, psych RN, and I've seen this therapy used with great success. Repetitive transcranial magnetic stimulus, RTMS, which uses magnets to activate the brain. RTMS does not require anesthesia and targets only specific regions of the brain to help reduce side effects such as fatigue, nausea, mental memory loss that can happen with ECT. Perinatal depression is a mood disorder that can affect women during pregnancy and after childbirth. The word prenatal refers to the time before and after birth of a child. Prenatal depression includes depression that begins during pregnancy, causing prenatal depression, and depression that begins after baby is born is called postpartum depressions. Mother with prenatal depression experience feelings of extreme sadness, anxiety, fatigue that might make it difficult for them to carry out daily tasks, including caring for themselves or others. Epidemiology. After COVID, there has been a 75% increase in perinatal complaints and concerns. Wow, that is a no-brainer. Since COVID, economical costs for perinatal mental illness have triple-fold increased, which has been suggested almost 1.25 billion, which does not include an impact on infants and the families associated with the mental illness. Diagnosis and criteria. Perinatal mood and anxiety disorder, PMADS, are grouped with postpartum depression, PPD, MDD with postpartum onset, brief psychotic with peripubertal onset, GAD and separation anxiety, panic attack, suicide, non-suicide injury, schizoaffect, bipolar 1 and 2, and the screening tools including the Edwin Postnatal Depression Screen, EPDS, and the PHQ-9. Labs to rule out medical causes. Always start with therapy. That's our number one. What type of therapy is best for postpartum? At the present, interpersonal psychotherapy is the best validated treatment for postpartum depression and should be considered first-line treatment, especially for depressed breastfeeding women. FDA recommends first line in medications is SSRIs. Population, now we get into the pediatric adolescent population from birth to 17 of age. Epidemiology. After COVID, research suggests increase in child and youth mental illness has increased 68%, with depression and anxiety leading the way. Economical cost is established to suppress possibly 1 billion, not including school violence and school shootings. Diagnosis and criteria. Intellectual development, learning disorder, autism, ADHD, MDD, substance abuse, anorexia, bulimia, sexual disorders, suicidal disorders. Diagnostic tools. The severity measures of depression, that's from the ages 11 to 17, the PHQ, the BID. Family training and family counseling is a must. Healthy lifestyle, medications depending on the diagnosis, and lab. LGBTQ. LGBTQ adolescents experience a higher rate of mental health disorders than their heterosexual peers. The purpose of this systematically review of the literature was to examine studies evaluating social support and effects on mental health in LGBTQ adolescent population. Higher levels of social support was associated with positive self-esteem. Lack of social support or lower social support was associated with higher depression, anxiety, alcohol, drug misuse, risky sex behavior, shame, and low self-esteem. The epidemiology cost financial impact of LGBTQ conversion therapy in the U.S. is new research shows that practice created economical burden of $9 billion annually, meaning that a lot of times conversion therapy, I kind of want to drill that because we do know about some of the other therapies being helpful, but we're talking about the harmfulness of conversion therapy. 8.5 times more likely to report having attempt suicide. 9.5 times more likely to report high levels of depression. 3.44 times more likely to use illegal drugs. 3.4 more likely to be at high risk of HIV and STD. Treatments that work: social therapy, acceptance, medication for depression, anxiety, etc. Immigration, migrant workers. Immigration, meaning the word migration, refer to those who move to other places in search of work or better living condition. The word immigrant refers to those who have moved to a foreign country permanently for work to live. Epidemiology, foreign-born Mexican Americans, Asian Americans have significant higher life prevalence rate of mood, anxiety, substance use than their U.S.-born counterparts. Rate of any drug use disorder are up to 8.3 times higher in the U.S. born Mexican American than those are Mexican born. Economical impact, different comparison of cost impact. It is a it's a variety. It has different. When I studied that, it was just different impact. It depends on what the location, the region, what government is available. Diagnosis. They can use the MMD, PTSD, anxiety and adjustment, and substance abuse tool. Screening also includes Refugees Health Screener, PTSD, Harvard Trauma Questionnaire, PHQ Cage Questionnaire. More difficult depending on treatment is more difficult depending on location, available resources for immigrants and population, limiting funding and once again in different regions and what kind of programs are available. We must advocate for same treatment and therapy as American citizens. Ethnic minority groups in the United States, for example, non-Hispanic white consult the majority, 63%, and all other race and ethnic groups, Mexican, African American, Asians, Asian American, Indians, and Native Hawaiians are classified as minorities, as of other. Epidemic racial gender, sexual minorities often suffer from poor mental health outcomes due to multiple factors, including accessibility of high quality mental health care services, culture, stigma surrounding mental health, discrimination, overall lack of awareness about mental health. Costs: serving and treatment minorities and underserved population has been estimated to be in the billions. In both DSM-5 and there are traces of all three strands with looking at cultural aspect incorporated. DSM-4 and 5 specific, the culture is addressed in the manual in three different ways. A discussion in the text of cultural variance and clinical presentation of those disorders that have been included in DSM-4 and 5. A description of culture-bound syndromes that have not been included in DSM-4 classification, and an outline for cultural formulation designed to assist the clinician in systematically evaluating reporting impact of individual cultural contexts. Treatment involves advocating for healthcare disparities, social and interpersonal therapies related to cultural difficulties, aware of culture related medical health issues such as chronic diabetes, hypertension, long-term care, homeless, extreme poverty, domestic violence, PTSD, and depression related to cultural disparities. Labs to rule out medical issues, medications, hospitalization to stabilize. And that is my reference sheet. And thank you for this presentation.